Hello, and welcome back to your guide to COVID-19. I hope all you guys are doing well today. In today's video, we'll be discussing eating disorders and what you can do to prevent them.
Eating disorders are psychological issues associated with irregular eating habits, such as eating too much or eating too little. Some examples of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by severe food restriction and excessive exercise. It can be life-threatening and has the highest mortality rate from all eating disorders. People with this disorder are terrified of gaining weight and view themselves as overweight when in reality they're underweight due to starvation. Anorexia nervosa can also cause depression, anxiety, and heart disease due to cardiovascular strain. Anorexia nervosa usually develops during adolescence and can occur in both males and females. Bulimia nervosa is associated with binging and purging. Individuals that suffer from this disorder consume large amounts of food. However, they begin to have feelings of guilt and shame because they seek weight loss, which leads to self-induced vomiting and starvation. Binge eating disorder, like bulimia, is also linked with eating large amounts of food and feelings of shame afterwards. Although purging behaviors are not involved, binging causes extreme weight gain and obesity. Eating disorders can be identified in many ways. First of all, a person's appearance alone can provide insight into their eating habits. For example, as mentioned before, a person with anorexia nervosa would be extremely frail and underweight, while a person with binge eating disorder would most likely be overweight or obese. Additionally, a person's behavior can also provide useful information that can identify an eating disorder. Fear of weight gain, avoiding meals, mood swings, compulsive exercise, obsessive rituals around food, and suicidal thoughts are all signs of eating disorders. Overcoming an eating disorder requires gaining confidence and accepting oneself, as well as gaining the right amount of nutrients to recover weight. Several health professionals can aid in recovery. For instance, a primary care physician can refer the patient to an eating disorder therapist or counselor. Clinical psychologists work closely with patients to identify the cause of the disorder and establish a proper plan of action. Dietitians and nutritionists can create diet plans and alter the patient's nutrition intake based on their medical condition. Now that we've discussed harmful eating habits, let's take a look at a healthy, balanced diet. A healthy, balanced diet should include carbohydrates, fats, and proteins. Consuming too much of any of these is unhealthy and can cause weight gain. Other healthy eating habits include avoiding binge eating, consuming fruits and vegetables, and limiting sugary foods.
Quarantine and social distancing can increase the chance of people acquiring these eating disorders. However, this can be prevented by talking to medical professionals and eating a healthy and balanced diet. Thank you for watching our content. If you wish to see more, please make sure to like and subscribe. Thank you and see you soon.